Welcome to London Foot and Ankle Surgery. Now, heel pain is one of the most common presentations in our clinic. Internationally, we note that in the Western world, 1 in 5 persons will at some point in their life suffer from heel pain. And the most common cause of heel pain is by far plantar fasciitis. Essentially, the heel bone has an attachment of a ligament that supports the arch, and it typically gets inflamed and strained near the heel bone insertion. Patients will often present with pain first thing in the morning or initially or after periods of rest where they've sat down at their chair and suddenly get up. In many patients, the pain may settle with anti-inflammatories after a week or two, but if it persists, then it needs to be assessed by a clinician. One of our podiatrists will assess you in terms of your mechanics as to whether your plantar fasciitis is related to flat feet or poor mechanics of the feet. Sometimes it can be related to injury, putting on weight, or during the latter stages of pregnancy appear to be a common reason. Often we also see patients who do the wrong activity in the wrong shoe. So they're wearing a shoe with very little support and walking many distances or playing sports. If the pain persists more than 6 weeks, it becomes more chronic. In the initial stages, you can manage at home by stretching your calf muscles, icing the area. Should that not work, then we will provide the necessary treatments after assessment. We sometimes perform ultrasound scans. If the clinical examination is not clear, we can assess the thickness and swelling of the ligament. Following that, we will offer you treatments such as shockwave therapy, which delivers shocks that resonate with the tissues and improve the blood flow and allow the ligament to heal. This, alongside rehabilitation with physiotherapy and stretching, can benefit approximately 70% of patients. Some people also need to wear more supportive footwear or possibly insoles or orthotics in some cases if they have feet that are abnormally pronated or show abnormal foot structure. Other treatments include injections for very severe pain or boot immobilization to allow the tissue to rest, especially if there's tear or rupture associated with the fascia. If you do have heel pain, please do get in touch with our clinic and we will be happy to talk to you.